It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
Hello everyone, I'm Dr. Annie Varghese and welcome back with another edition of the Best Docs Network, featuring some of the best physicians in the Houston area that have helped to change people's lives. We have a great show for you today. Let's learn more about our first doctor, Dr. Robert Marvin.
Altogether, from now until then, I have lost 143 pounds in 6 months, which I am ecstatic about. You know, really, I was just absolutely loving it.
He lost another 40-something pounds, so that his total percentage of weight loss is about 35 to 36% of his extra body weight, which, to be honest, is somewhat behind the curve for an average patient. And then we did go over a few things today which hopefully will stick in terms of what he's eating. You know, he confessed that he's having bacon and cheese at dinner time, but yet he gets full after 5 or 6 bites. So if we can get him to substitute those foods that are high in fat calories for foods that have a lower density of calories, he ought to be able to lose weight and feel full.
I definitely have noticed I walk faster, I get around better, I feel better, I sleep better, you know, I mean, just everything, you know. I've noticed a difference, you know, especially with furniture. You sit down, you know, hey, I can sit easier, you know, you lay down, hey, I feel better whenever I lay down. You feel more energetic, you know, you just really, you know, and it gets better and better as you move along, you know.
Yeah, I mean, his body mass index has come down nicely, so right now he's moved into a less risky area in terms of his weight than where we started. He's picked up his exercise rate recently. If he's consistent with that, that should be helpful.
You know, it's been an adjustment, it really has, like everything, you know. It's a new way of life, you know, and it's a permanent new way of life, you know, no reversing, but I'd do it all over again if I had to, so. Well, like I've said every time, you know, for any patient who might see this video, if you're thinking about getting it done, you know, do it, you know. I mean, it's an adjustment, but it's worth it. After everything you have to go through, everything that might come your way, you know, however difficult it is, it's worth it, you know.
We are 1 million strong. We are united behind a cure. There are over 1 million colorectal cancer survivors in the United States. My name is Charles Kelly from Lady Antebellum, and I'm in this fight against colorectal cancer because it actually hits pretty close to my family. My father-in-law was diagnosed with it, and the thing about this disease is it is preventable, and so I encourage everybody to go get screened. Let's beat this thing.
Welcome. Today we have with us Dr. James Willerson, who's the President and Medical Director of the Texas Heart Institute. Dr. Willerson, we're so thankful that you're with us today. Welcome to our program.
Thank you.
We know that you've had a long history here in Texas with regard to the advancement of cardiovascular services. Would you tell us a little bit about the Texas Heart Institute?
The Texas Heart Institute was founded in 1962 by Dr. Denton Cooley as a research and education entity. And I think he dreamed that it would train many doctors who wanted to be heart doctors, cardiologists, surgeons, electrophysiologists, pathologists, so on. But that it would also do research, which would be important in preventing cardiovascular disease and making it easier for people to tolerate it when they already had it. And that's the way it's worked out over the last 50 plus years. It's ranked number 6 in the United States. It's been ranked in the top 10 for each of the last 22 years consecutively. There is no other heart center in Texas for which that same thing has been true. And we have educated thousands of doctors in all areas of cardiovascular disease.
I know that your great passion is teaching, and I've been able to sit at your feet and actually learn from the master, and I just thank you for that.
Thank you.
In front of the world, you are an amazing teacher.
Thank you.
And I know that you have taught many, probably thousands of students in internal medicine as well as cardiology. We want to thank you for that. And what would you tell the world about those who have that love for cardiovascular medicine and to study medicine? What would you tell those students?
Well, it is a passion, but it's based on the reflection that heart and vascular disease are the #1 killers of men, women, and children, not only in the United States, but in the world. Cancer's a distant second. For instance, as a woman, you're more likely to die of heart and vascular disease than you are of all cancers combined. And as a woman, you're 5 times more likely to die of a heart attack than you are of breast cancer. And as a man, 1 out of 2.5 men worldwide will have some form of heart and vascular disease during their lives. A person dies in the United States every 26 seconds, 24/7, of heart and vascular disease.
So we want to let students know around the world to continue reaching for their passion of saving lives. And we thank you for being a leader in that, Dr.
Thank you
Willerson.
very much. You're very kind.
You are a tremendous, tremendous person. I just thank you from the bottom of my heart.
Thank you.
To be a comprehensive breast center, it doesn't mean having a nice building and a nice name on the center. There's a lot of people that have done that. What makes you a comprehensive breast center is working with other physician specialties together to do the best that you can possibly do for each patient. It's important that when we find an abnormality, that the radiologist understands the pathology, knows what to biopsy, when to biopsy, and then can communicate that back to the referring physician, communicate it to the patient, and communicate to the pathologist what our concerns are. This is what the beauty is of a comprehensive breast center. So it really means working together as a team, working with your breast surgeons, working with the pathologist, working with the radiation oncologist, the plastic surgeons, and we work as a team. When people come to TOPS Comprehensive Breast Center, or if they come to one of our Memorial Hermann Breast Centers, what they'll see is a group of dedicated breast radiologists. So when they come to one of our centers, they're dealing with a radiologist who is focused on finding cancer at the early stage. And one of the things that we talk about as a group, we want to disrupt as few lives as possible while finding cancers at their earliest stage. That's our mission statement. If someone comes in and then we have a finding on the mammogram, or they come in with a palpable lump and they need an ultrasound. In many facilities, this is performed by a technologist. The doctor may or may not ever see the patient. If they do see the patient, they only look at the area of interest. It is our policy and our practice that radiologist comes in on every patient. We scan every patient ourselves. Yes, our technologists look, but we scan every patient. My strong belief is, and I think statistics prove that, is that when you have specialists doing this,
you get a better result. In our practice, that's what we do. That's the whole focus of our practice. You know, it's a very special group of people from all over the country, from very well-trained facilities, and so it's an exciting group to be part of.
Our smile is one of our most important assets, and Dr. Guy Lewis knows this. He's a well-known cosmetic dentist here in the Houston area. Let's hear the story about how Dr. Guy Lewis has helped many patients.
I found out about James through a local chiropractor who has treated a lot of wounded warriors and has worked with them and donated his time to help those guys.
On February 26, 2006, we were on a presence patrol, and we got some information that they were making IEDs in a mosque, which is a place that is, the majority of the time, a place where we can't go mosque in schools. But anyway, we went there, we followed the information, detained some personnel, and as we were leaving, there was an SV bit on site that detonated right next to my striker. A piece of shrapnel entered through my helmet over my left ear and gave me a skull fracture, a windshield skull fracture.
He was in Walter Reed for a long time, coma, trauma, and he's made a remarkable recovery. He's self-conscious about his teeth. And it's not that they were broken up or damaged in the accident that he had, but he's studying to be a nurse practitioner. And so he's seeing people in the clinic. And so then he's going in and talking to patients and people.
I have a very stern and aggressive approach, and it's just ingrained in me after 10 years of being a ranger. That's just how you communicate. I'm learning to smile. And then I realized, growing up I was embarrassed about my smile, and when I see my patients and I don't smile, it's hard for them to, this guy is too serious for me to be treating me, he's mean.
He just had a self-consciousness about his teeth, and yes, they definitely could use veneers. He has some teeth that are real crooked and tucked in and stuff, so he's a perfect candidate.
The whole team here, they've taken me in, and I'm excited about the change because I know my demeanor is going to change as I work with my patients.
I have so much respect for these guys who go and put it on the line for our country. And my dad was wounded in the South Pacific in World War II, and I'm just a big supporter of our veterans and what they do. So I wanted to help this guy. I just wanted to, and I think he's going to get a fantastic result.
Tiku broke his jaw growing up and his teeth never lined up until he met oral surgeon Dr. Paul Metz. To find out more about Tiku's story and other life-changing stories, log on to bestdocsnetwork.com.
Breast cancer is a scary thing. It's the second most common cause of death in women. Also, 1 in 8 women will get breast cancer at some point in their life. That is a really big number. For example, if you're out with friends of yours, there's 8 of you there, one of y'all is going to have breast cancer at some point in your life. That really is scary. So what do we do about breast cancer? How do we discover it? Well, there's been a lot of emphasis over the years on doing home self-breast exams, monthly in the shower. Well, recently the studies show us that really isn't a great thing to do. Women pick up lumps and bumps and things that they feel in their breasts that require us to do mammograms and checkups and then biopsies, and it seems like the benefit from that isn't that great, and the risks of overdoing the testing and the biopsies is worse than just not doing it at all. So self-breast exam is not as important as it used to be. It doesn't hurt, just don't overcall things. There are really minimal ways that you can prevent breast cancer. Basically, there's a family history is a strong risk factor. Being heavy and gaining weight is a risk factor. You just need to have your mammograms regularly. That's the best way to detect breast cancer.
For additional medical minutes from Dr. Honaker, log on to bestdocsnetwork.com, click on Education and the Medical Minute tab.
For more information on any of the doctors you've seen on today's show, go to our website, bestdocsnetwork.com. Now it's time to head to our next doctor, Dr. Meredith Morgan. Dr. Morgan is an OBGYN who has been practicing in the Houston area for many years. He's touched the lives of many patients. Let's see the next story about Dr. Meredith Morgan.
Osteoporosis is a disease. It's a disease of bones. It manifests as either a fracture or the realization that the bones are very, very thin with a high risk of fracture. It's important, it's common. It happens in over 50% of women postmenopausal. That's to say, over half of women over the age of 50 are going to have a fracture in their lifetime. And it's serious because some people that have hip fractures will die very quickly. And some people will go into a nursing home and not get out. Since it's a function of time and duration of estrogen deficiency, the time since estrogen deficiency with the thinning of the bone is predictable. It may be needed sooner if there are other risk factors for thinning of the bone sooner. Smoking, extreme thinness, sedentary lifestyle, parents' history, or a previous low trauma fracture. The most objective way to quantitate the status of the bone health, thickness or thinness, is to measure the areas of interest of the spine and the hip, since those carry the most risk of morbidity and mortality. It's done on an X-ray type device called a bone density unit. It's painless, it's easy, it's safe, involves lying on a table and being positioned as you're able. It's not exactly the same as doing x-rays for fractures, although it may be more sensitive for certain kinds of painless fractures. It's not for diagnosis of various diseases or fractures in general. The ultimate goal of screening is to prevent death and disability from fractures. We're trying to predict fractures based on age and the thickness of the bone. If someone has very thin bone, then they have a very high risk for fracture. We recommend that all women have bone density testing at age 65 and sooner if they have risk factors that would indicate that they would have high or increased risk for fracture.
For additional health information, be sure to check out our Healthy Living blog for the best tips, latest medical procedures, and up-to-date news for modern medicine at our website at bestdocsnetwork.com.
Gina was looking for long-term effective birth control, and Dr. Marie Sleepman's E-Sure procedure was the perfect solution. To hear more about Gina's story and other life-changing stories, log on to bestdocsnetwork.com.
Ablation therapy is used to treat arrhythmias that come from the top of the heart, known as SVT, or from the bottom of the heart, known as ventricular tachycardia, non-sustained ventricular tachycardia, or other types of arrhythmias. Now, ablation therapy sounds scary to most people, but it's really very simple. We take the patient to the cardiac catheterization laboratory, sedate them, of course, and then put catheters to find the area of the problem in the heart, and then easily make a tiny burn, and the rhythm is gone. So many people suffer so many years with tachycardias, palpitations, and these things can easily be taken care of with ablation therapy. So I think the news about ablation therapy should be given to the public. So many people are having atrial fibrillation even that don't know that they can get off of their medications by having ablation therapy. It's an interesting topic, something you should look up, and we'll bring more information as we get it. I have such a great passion for treating cardiovascular patients. My stories go on and on, but I'd like to share this one very important story about a patient that I was able to take care of in my own practice. Let's watch the story. I hope it touches your life.
As you get older, sometimes you have trouble finding words. So my daughter got all worried, so she'd maybe go to a neurologist. So he does his thing, go back later, he said, it looks like you had a couple small strokes. They're small, they're not going to bother you. But, he says, you need to go to a cardiologist to check out your heart, just to be on the safe side.
Valvular heart disease encompasses many different entities. The heart has 4 different valves, and Gary Singerman had actually infection and rupture of his mitral valve, which is a very important valve separating the top and bottom chamber of the left side of the heart.
So she sent me to Houston Northwest Hospital, where she had them ordered ultrasound for me. You know, I feel fine. Can I go home now? So my wife and I are sitting there, and she comes in with this film of the ultrasound. She says, could you see the mitral valve there? I said, no, I'm not trained for that. So she points with it to her pen and says, right there, it's hanging down in the ventricle. It's been ruined with the bacteria, and it's not doing anything. And so she says, within a month, you're going to have a massive heart failure. And I heard my wife gasp, and I got rocked. Wait a minute, I feel fine. She said, I'm checking you into the hospital right now.
Mr. Singerman had mitral valve prolapse, therefore the valve was not closing properly, was redundant and thick, and therefore it was easy for bacteria to stick to that valve and cause infection. And this happened before I met him, and his story is quite interesting, how he came to me. He immediately needed surgery because his valve was infected and ruptured and not working at all. But he's very thankful that he came because we were able to save him.
Obviously, I lived, but the point is I may not have if Dr. Verghese hadn't caught that ruined mitral valve, and so I owe her.
Jack from Tomball has a question for Dr. Annie. How can airplane travel cause clots and death?
Long travel can cause venous flow to decrease, so therefore the flow in the legs can kind of pool and accumulate and not come back up to the heart. When that happens after patients are sitting for long periods on an airplane, clot can form because the blood becomes stagnant. To prevent that, we tell patients to walk the aisles of the plane, exercise the legs even while sitting, and try to stand up intermittently throughout the flight. This will protect the clot, the patient from having clot formation. What happens when the clot forms is when the patient finally leaves the airplane and gets to their destination, clot can move and go up to the lungs and cause sudden death from a pulmonary embolus. Very critical to know about clot formation, very critical to prevent it, and easy to prevent by just moving. Actually, sometimes wearing hose will help, and knowing the risk factors of flying can prevent a problem when you get to your destination.
The symptoms is I had headaches, a lot of congestion, infections in the throat, a lot of mucus in the back, ear headaches, so much stuff going on.
Janice Martinez is a patient who came to my office complaining of nasal obstruction, facial pressure, constant headache. She has been treated under multiple medication, including antibiotics, antihistamine, nasal spray, without really, without any good success.
I went on, but then I started getting infections, and I was on antibiotics for 4 months in a row. They kept giving me, so I was like, this is not good.
So when we examined Miss Janice Martinez, we found that her natural sinus drainage pathway It's obstructed by chronic inflammation, chronic infection. So we offer her the option of doing balloon sinuplasty.
The best part was the breathing. I could breathe again. The headaches, little by little, started going away. Now when I sleep, I would breathe real loud. My husband will always say that, and I don't do that no more.
So when you have a chronic sinus disease, that passage, it's obstructed, it's narrow by chronic inflammation, chronic infection. So what we do is we put a small balloon in the passage and we open up, you inflate the balloon and open up the natural passage, preserving the normal anatomy.
And I don't sound like I have cold all the time. Before I was like sick all the time. And now I'm doing great. I could go out, do everything, and I feel good.
One of the advantages is the quick recovery. There's really no downtime to balloon sinuplasty. The procedure can be done in office, under local anesthesia or the topical anesthesia with some nasal spray. There's not really a recovery time for balloon. The patient can go back to her daily activity the next day, and compared to a traditional surgery, which the recovery can last to a week.
A bunion deformity is a deviation of the first metatarsal and the second metatarsal. So basically, what people see of their big toe is this. So the big toe is pointing this way, and this bone is going out this way. When it's not matching up well, you get bone growth. And so bone starts to build up right here, and it also starts to build up top.
I spend about 85% of my time traveling, so I'm in and out of the airports. As a training manager, I do a lot of facilitation. So I'm on my feet a lot walking, and it got to the point where even flat shoes, what most people would think is comfortable shoes, became painful.
Her surgery was an osteobunionectomy, but it was a little bit different because on the x-ray I discovered that she had severely arthritic joint. She had fracture fragments. So these fracture fragments never healed, and because they were constantly moving, it was severe pain. It caused an enormous amount of bone growth on the top and on the side. So I was really excited to do her surgery because I knew it would provide immediate relief.
I'll be wearing the boot for at least another 4 weeks, and then I'll come back for another reassessment. And then he'll determine then whether I can take the boot off and then just start walking in normal shoes.
People always ask, why do I have this problem? And the biggest component is genetics. So if you look at your parents' feet or your grandparents' feet, it's basically telling you, if you see a bunion deformity, that your chances are your feet are going to develop these structural deformities. Then obviously for the females, it's wearing the high heels. It's there's a price to pay for high fashion. You wear the high heel, it puts your foot in position, which predisposes you to a bunion deformity.
I would love to be able to get back out there and be pain-free. A lot of times I couldn't wait for the day to end because I would be in so much pain. So I'm looking forward to being able to be on my feet for longer period of times pain-free.
The look on the patient's face when they come in and they see the results and they're happy with the results, and they see that instead of having a crooked toe, or that it's actually straight, and that the pain that they had before is gone. So, that's the rewarding part to me.
I hope you've enjoyed this latest edition of the Best Docs Network, featuring some of the best physicians in the Houston area that have helped change people's lives. For more information on any of the fine doctors that you've seen on today's show, head to our website at bestdocsnetwork.com. If you have a question or a comment for us, we'd love to hear from you. Send us an email at info@bestdocsnetwork.com. See you next time.